Hi, I'm Dr. Angela Bonagera at the St. Tammany Women's Pavilion, and I am so excited to talk to you about this new pioneering procedure we have for patients with breast cancer, and it's something called MagTrace. Part of the standard of most of the breast cancer surgery that we do is sampling the lymph nodes or removing the lymph nodes, taking them out to check to see if the cancer has spread there. The problem with this, even though we've transitioned over the years to less invasive types of surgery, the sentinel node biopsy, one of the problems is I'm disrupting the lymphatic system. So it's like busting pipes and blocking pipes. So that fluid backs up into the arm, makes the arm swell, and that is called lymphedema. We've learned about better procedures, and it's always better to do less surgery if you can. Now we have something even better than that. It's a pioneering thing that we are extremely excited about. We started it in the fall of last year in 2021, and it's something called MagTrace. And that's where we inject a iron-coated colloid particle in a liquid form into the breast, and this tracks, just like the old types did, and marks that lymph node. So we don't even have to take it out at all. We don't have to disrupt the lymphatics under the arm, because even though it was better to take out less lymph nodes, it's even better to not take out any. So that risk of swelling of the arm, lymphedema, injury to the nerves, that is obliterated if we don't have to take out that node. And this cannot be done for all cases, but there are some where we're able to not disrupt that system. And if we can do less surgery to help these patients and decrease that risk, that's what we want to do. And that's what this procedure does.